Morning Crossfire with Femi D Live on your number one talk, news and sports station, 95.1 Nigeria Info.
Many thanks for staying with us right here on Nigeria Info 95.1. This is Morning Crossfire with Family Live. And yes, the conversation extensively has been quite educative. And yes, really changing how things are. My guest via telephone this morning is Professor Titus Ibekwe. He's a consultant ENT surgeon and public health professional. He's also the chairman of the Continuing Medical Education of Nigerian Medical Association and the HOD of ENT Head and Neck, University of Abuja. Good morning once again, Professor.
Good morning.
Yes, sir.
Thank you for the great job you're doing.
Thank you so much, sir. So let's move on a little bit now. So we understand the stages, the infection, what the infection is, and the likes of it. Now, it's been interesting. You mentioned the fact that coronavirus had been around before, but this is a new stream, in one way or the other. Let me ask you this. As simple as it may sound, everyone around is wondering what's the difference between vaccine and cure?
Okay.
Yeah,
The difference between vaccine and
cure, because around the world it's been talked about that there's no vaccine has been developed yet, and well, the cure for coronavirus as well is not there yet. What's the difference between these two in terms of with relation to this disease, so that people can understand if they exist or they're still in the works?
Yeah. Vaccine, as we know, is immunization. It is trying to give some shots of either the antibodies or an attenuated life form of a disease-causing organism, introducing it into the body of individuals who are not infected. The whole idea is to help boost their immune system or prepare their immune system to be able to fight whenever they get exposed to this illness. So that is, the vaccine is the shot or the vial or the injection that you give to the individuals, various individuals, which will give them some level of protection against this infection. And because whenever the system gets exposed to any organism and the body is able to conquer, the system is able to elaborate antibodies and some level of immunity, which will easily recognize this organism when it is exposed to in the future and instantly destroy it. So that is what vaccine is all about. But when we talk about cure is treatment for somebody who is already infected. All right?
Yes, sir.
Somebody who has not been vaccinated, who doesn't have this immunity against, but is infected and is down with the disease. So the drug, whether it is tablet or injectable or in any form, you give to this individual in the appropriate dose and the appropriate duration that has the ability of destroying the organisms within the system of such an individual and giving the body room for healing and effective recovery from the infection. So that's the difference between talking of a cure, which is treatment, and talking of vaccine, which has to do with immunization and building up of the immune status of individuals against uncertainty.
Okay, sir. I do know that globally there's been the talk about chloroquine, chloroquine and having an additive to chloroquine in one way or the other for treatment. But that's a whole new conversation. It's right. I'm afraid there are fake chloroquines in Nigeria that's being manufactured and being used at this time. But globally, it is believed that there have been about 70. I'm following what the John Hopkins University of Medicine did release. I was reading through their report about the coronavirus. They have a visualizer that talks about the deaths, the cases, the locations, and much more. 74,000 deaths globally, 74,816 precisely deaths globally. And yes, total recovered 284,802. There's been recovery of over 77,000 in China, Spain with 40,000, Germany with 36,000. And those numbers appear to go on and on. And in some weeks, it appears sometimes some countries have recovery, some countries have death. In Nigeria, it appears the numbers indicate that we may be having an excellent recovery pattern, if one can almost confidently boast of, to say, with the number of deaths so far in Nigeria, which is just about 5, and total confirmed cases of 238, at least that's according to the official records. Sir, let me ask you this. The recovery process in Nigeria, what is being administered that made it so far so good, appear excellent, that we have this covered to an extent?
Femi, thank you very much once again. I think Nigeria so far has been an excellent story, a story to share about. This could be corroborated by the recognition of the World Health Organization. Just 2 days ago, the director made some statements referring to Nigeria as a good example to the entire world to emulate. But I think it's too early for us to beat our chest. It's a wake-up call. We shouldn't go to sleep. So whatever thing we're doing, we should do better. It's still too early to judge because our calls have not come to its peak and it has not flattened. So let's watch and see. But looking at the preliminary report of what we have so far, I tend to agree with you that it appears we are doing very well. Because as we know, documented worldwide is that the expected mortality should be between 3 to 5%, which means 3 to 5 deaths per 100 cases. That is expectation. But now, if you project this, you see that we have done more than excellently well. You're talking of like roughly 1 death or 2 per 100, approximately. And all these people are actually people that have a serious underlying illness before contracting the disease. The second part of your question, what are we doing that is very special in the country? I wouldn't say there's anything I think we're doing that is extraordinary from what the rest of the world is doing. However, some inherent factors that nobody can define right now, there are a lot of speculations out there. The important thing is trying to build up the immune status to support individuals who have already contracted this disease, ensure that they feed well, good balanced diet, they have all the micronutrients that is needed, assist the system in building up its immunity, to equally ensure that you treat symptomatically any problem that crops up, that you handle that appropriately. and hydrate these individuals very well. Let them have very good rest. And those that need oxygen supplementation to receive that. Once that is done, you are creating room and avenue for the immune status to build up very well and be able to fight back and win the war. And once the war is won, the stream of virus in the system is completely cleared. And you start talking of individuals testing negative. And that is when you say that a person is healed. The other drugs that have been making rounds, like hydrochloroquine, azithromycin, zinc, etc. Well, I will say that they have shown some good signs for us to believe that there are prospects in them. But again, it is highly anecdotal at this stage because there are scientific processes that a drug trial must pass through before it is certified fit and due for management of treatment or treatment of a particular illness. Another factor that individuals are looking up to is, looking at the nature of our country, taking into cognizance that a typical Nigerian sub-Saharan populace, that we are naturally exposed to a lot of infections right here. So malaria is here on one hand. We are battling with Lassa fever. We are battling with endless bacterial and viral infections. That our body could have accumulated a lot of immunities for different types of infections and illnesses in the past. And who knows, there could be a cross immunity of a sort from all these accumulated viruses that could have had some resemblance with the current one. So if this is true, then that means it is possible that individuals down here would have had some level of innate immunity even before contracting this illness. But as I said, all these are still speculative. And out there's also this theory that has also been put across, that it appears those countries that have BCG, that is immunization against tuberculosis, as part of their policy over years, that it appears the level of devastation this illness is not as serious as it is seen in these particular countries that have either not commenced BCG or that abolished this some years back. And we know that this part of the world, BCG is still part of our routine immunization. So anyway, these are areas that are worthy of looking into. But I said it is still too early to tell or to beat our chest.
Yeah.
I encourage each and every one of us to play our role, the populace, the government, NCDC, and indeed all of us in doing what we are supposed to do to ensure that this is brought to the direct minimum.
I agree with you because I was looking at the story from Time Magazine about Shenzhen in China, where they said the cases of lingering infection. People who had COVID-19 who are tested positive, went through treatment and were discharged, but then still had that underlying sickness turned out positive yet again, either because of medication that they stopped taking and the likes of that. And that's a whole new concern as well, even for us in Nigeria. The issue of discharging patients and then monitoring the progress of the patients. What's your take on that?
Can you say that again? Just a brief summary.
Yeah, in China, there's been, they talk about lingering infection, which is the fact that the person is not reinfected. However, the lingering infection is that they end up having been discharged from hospital, they're at home, and the likes of that. After some time, they start to show those symptoms again because the infection is still within their system. Their viral load is still there, and it troubles one because I was also concerned about the spate of the discharge we're having in Nigeria, the number of cases we're discharging within a short period of time. What's your take on that?
Oh, okay. I'll get you correctly now. As I said earlier, this is a new virus, and if we don't, we should not forget that it is just, let's say, a little over 3 months old. Remember that it was the end of December that this comes to the scientific world from Wuhan, China. So a lot of studies are still on towards learning the characteristics and features of this virus. Naturally, in most cases, we know that most infections, once you acquire a good level of immunity, a reinfection immediately is usually, I'll say, is usually an odd. Is not the norm. But again, individuals and their levels of immunity have so much stories to tell. So it is possible that it's not even the residual that these individuals went home with that they are representing back with. There are possibilities here. One is a possibility of reinfection. If an individual is reinfected and the immune status of this individual is extremely weak to fight back, it is possible that they can still represent, but it's a milder form of the disease.
Okay.
That is one. Then two, if, for instance, an individual tested negative and within a short time retested positive, we can also start thinking, is it possible that it was a false negative report that this individual had? Because we are human beings, we can make mistakes, even though in the laboratory. False negative means that this negative is not true negative. Before the individual was discharged home, that there's still some level of this organism circulating within the system, which was not detected. So these are the areas to look into. But it's an exception rather than the rule. If you have such, it will be very, very insignificant percentage that will represent the same illness.
All right, sir. Before I allow you go this morning, I know today is World Health Day. Support nurses and midwives. What would you like to say?
Yeah, the nurses and midwives, they are fantastic. They are fantastic partners in progress. When you talk of health workers, the doctors, the nurses, the pharmacists, indeed, everybody in the field should be celebrated because these are special people. These are frontline fighters, people who at any point in time lay down their lives to save those of others. And this is why we are putting across this clarion call, not only to our dear country, but to the world at large. So there is need, very urgent need, to ensure the lives of these health workers. Remember, there's lockdown. Everybody is right now at home. But these frontline workers, they're out there battling in the field. So the least is that their lives should be ensured. The minimum is that they should be given all the necessary equipment to be well protected. Minimum requirement is also that reasonable allowances should be paid to them, at least to give succor to them and their family. The so-called hazard allowance of 5,000 naira that is making around everywhere, it is ridiculous to say about the least. A hazard allowance should be a key percentage of the salary. You tie a percentage of the salary earned by an individual to that. That is apart from the life insurance that should be given to these individuals. I think that's the minimum we should do to support our health workers, to give them that sense of belonging so that they'll keep on battling this fight. It is for the betterment of each and every one of us.
I have to say a big thank you to you now, Professor Titus Ibekwe, for joining in on the show this morning. We've learned so much. So much is the word I like to use from you this morning. It's been splendid listening to you this very morning, and your contribution. I will tell you, a lot of people have learned. I'm seeing messages I did get here and now where people are saying to me, "Wow, so much so it's good to understand how this virus, pretty much gets into people's body and how things can be done differently." Well, just for those who joined us halfway in, Professor Titus Ibekwe is a consultant, ENT surgeon, and public health professional. He's also the chairman continuing medical education of Nigerian Medical Association at the head of the department of ENT, head and neck in University of Abuja. Thank you so much, sir, once again.
Thank you very much, Femi. The knowledge came from God, and we're happy to give back to his creation. I'll answer you at any time.
Thank you so much, sir. Thank you, sir.